someone that can't come up. So could
I'll
you
do this one first?
Yes.
Okay.
Can you understand
Okay,
that?
yes, I can read it. It says, can you speak about ALS, Lou Gehrig's disease, amyotrophic lateral sclerosis? When I talk about ALS, I also will be talking about MS, multiple sclerosis, and also Huntington's disease, and also Parkinson's disease. All four are approached the same way with nutrition. Parkinson's disease, Huntington's disease, MS, and ALS, Lou Gehrig's disease, all four. So nobody will need to ask about these because it'll be the same approach nutritionally. Now I'm going to talk about 100 pounds. The dose goes by poundage. So we'll talk about a dosage for 100 pounds. It'll be one healthy brain and heart pack, one healthy brain and heart pack per 100 pounds of body weight. Remember, that's for those four diseases. And get an extra bottle of the secret sauce we call selenium. And so they can take 6 a day, 3 at breakfast, 3 at dinner, or 2 at breakfast, lunch, and dinner. And then I'll also take a program we call Synaptive. If you know about brain functions, synapse, where the one nerve fiber speaks to another, synapse, synaptive, okay? Synaptive, okay? And I want you to take 3 of those twice a day per 100 pounds of body weight. It'll be 2 bottles a month, Synaptive. And then you need to eat 8 eggs a day per 100 pounds of body weight. They cannot be fried. They cannot be cooked in oil or margarine. They have to be either poached with a soft yolk or soft boiled with a soft yolk or soft scrambled in butter. And that's to give you the cholesterol necessary to rebuild the brain, the part of the brain that's damaged. They're all really the same disease. It's just a matter of where in the brain the more severe damage occurs. You get a different symptom based on the different parts of the brain. And they give it a different name. You could have all 4. You could have MS, ALS, Parkinson's disease, and Huntington's disease all at the same time. But doctors will pick the name of the one that's most obvious and give it that name. Okay, so there you go. ALS, MS, Huntington's disease, and Parkinson's disease. Okay, gentlemen, yes, sir.
Right. Dr. Wallach, I thank you.
Okay, this microphone isn't working very well. I need to turn it on or get closer. Or...
I thank you.
There you go.
Thank you. I thank you for being here.
Thank you.
You're just talking about the brain. I've been hit in the head a couple of times. Pretty good.
Now, is this with a baseball
No.
falling off the roof? Or?
No, a brick.
A
Piece
brick,
of
okay.
steel coming down about 35 feet.
Okay.
Knocked me on my knees. I have problems with my knees and my hip.
Okay. Okay.
Maybe you could prescribe something for me.
Sure, very, very easy. The brain wants to recover. The brain can heal itself, contrary to what doctors say. Your brain can heal itself very nicely. And your nerves and your neck and your vertebrae and your hips and knees. And so what I would do is take 2 of the healthy brain and heart packs per month. 2, this is for head trauma. 2 healthy brain and heart packs per month, a full dose of everything at breakfast and a full dose of everything at dinner time, because you weigh somewhere around 200 pounds, give or take a few pounds. And I would also take the Synaptive again, take 3 of those twice a day. I'd also take the 8 to 10 eggs a day. But I also throw in the glucogel. The glucogel is the secret sauce to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, back, hips, knees. I'd have you take 15 of those a day, 5 at breakfast, 5 at lunch, 5 at dinner. And this goes for anybody that has osteoporosis, osteopenia, arthritis, bone-to-bone arthritis, rheumatoid arthritis, bone spurs, calcium deposits, periodontal disease. And whatever pack you take, you want to also take those 2 bottles of glucogel, so you can take 15 a day, so they'll support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Okay?
Thank you.
You're very welcome, sir. God bless you.
God bless
Okay, I'm going to jump over here. Yes?
I just want to welcome you for being here today.
Get a little closer. There you go. Thank you, Pastor.
Good afternoon. I just
Thank
wanted
you.
to welcome you for being here today.
Well,
It's
thank you.
our
Very
pleasure.
gracious. Thank you.
Also, I wanted to ask you about, I have a history of pulmonary embolism, and it imitates the factor V. You know, if your mother have it, you have it, but it isn't. So I wanted you to give me some
Sure.
advice on that?
Okay, pulmonary embolism is a blood clot, okay, caused by deficiency of omega-3 essential fatty acids, whether it's a blood clot in the brain, heart, or the lung. Pulmonary embolism means there's one of these blood clots in the lung caused by a deficiency of omega-3s or a ratio problem between omega-3s, 6s, and 9s. And obviously, when you take in inflammatory things like fried foods, it makes it worse. It makes the lining of the arteries all inflamed, so it makes the deficiencies worse. And so what I would do is go ahead and take 2 of the Healthy Brain and Heart packs per month, full dose of it twice a day. I would also take what we call the Ultimate Daily Classic. Ultimate Daily Classic, or tablets. I'd go ahead with 1 bottle a month, and that's going to allow you to take 3 of those tablets twice a day. And what it's going to do is support healthy dilation of the blood vessels in your lungs. It's also going to support healthy blood clotting systems, so you're not going to have a blood clot when you don't need one. And it's the Ultimate Daily Classic. Take 3 of those twice a day. That's in addition to the 2 Healthy Brain and Heart packs. None of the bad stuff, no fried foods, no processed meats, no oils, no gluten. So the next time I say none of the bad stuff, everybody knows what that is. And it's not genetic. The reason why your mom has it and you have it is because she has a gluten intolerance. She's passed that on to you through cord blood. Do you have children?
Yes.
Did any of them have any asthma?
Yes.
Bingo! Okay?
Yeah.
That's because those things are all caused by gluten intolerance.
Wow.
And so it's a trail from your mom's mother. All her sisters and brothers have it. Your aunties on your mama's side have passed it on to their children. If you have daughters, they better be gluten-free, because if they're not gluten-free, they will pass it on to their children. If they're gluten-free, they won't.
Wow. That's
Okay.
awesome. As a matter of fact, I never was asymptomatic of asthma until now.
Mm-hmm.
But my kids always like, Mom, you cleaning and that Clorox and, the smells.
No,
while
it's a
the-"
deficiency. Okay, so
Thank
now you know
you
what to
very
do.
much.
God bless you.
Yeah. God bless you. Thank
Okay,
you so
thank
much.
you. Okay.
Dr. Wallach, side note, for people that, how do we handle, so someone's out there listening, they hear you address someone that has what they're struggling with. How do they handle that in terms of going to the table?
Well, if they already know, if they're standing outside, if they're here, they go right to the table.
So if they're sitting out there and you address something that they
They
have.
can go right to the
And
table.
just tell them what they have?
Mhm.
Just, if they're streaming,
Oh,
what
if
do we
they're
do if they're streaming?
Basically, what I would do is collect some of this information on a piece of paper like you gave me before. We can answer one of those every time we do 2 of these, kind of thing. But you're blessed in having Michael and Kim, because they're very knowledgeable. And so you can email these things to them later.
Okay.
I mean, you can do this for the next 6 years. You can email these things to them, and they will know what to do.
Okay,
If they
just
run
not
into something
tomorrow
they don't,
on
they
Super
can
Bowl Sunday.
contact me.
Okay. The website, what's the website? Can we give the
No,
website?
well, they have to
We'll do it before we
yeah,
close.
get the website from them.
Okay.
Because we have thousands of websites based on individuals, and so
Gotcha.
I try not to have any in my head.
Okay, so everybody clear, if Dr. Wallach answers a question of what you're dealing with for somebody else, then you can just try to remember what he said, but more so go out to the table and tell them, I have this, and they'll tell you.
Oh,
Has
yeah.
everybody got it? Okay.
Hey, your turn.
Hi, Dr. Wallach. What would your diagnosis be for? I'm a 32-year-old woman who's had 2 heart attacks already.
Okay, 2 heart attacks. This was a blood clot in the heart, cardiomyopathy, bleeding heart attack. What kind of heart
Blood
attack?
clot in the heart.
Say again?
Blood clot. I have
Blood
4
clot, okay.
stents, but my cardiologist doesn't talk about nutrition at all.
I'm sorry, I didn't hear that last
I
piece.
said my cardiologist doesn't recommend anything nutritionally for me at all.
Well, it's because he knows nothing about nutrition. Okay, so you're kind of a big girl. What do you weigh?
200.
200,
10
okay.
pounds.
I would take 2 Healthy Brain and Heart packs per month. It's starting to sound familiar. Anytime a heart's involved, blood vessels involved, heart attack, stroke. So you want 2 Healthy Brain and Heart packs per month, a full dose of everything at breakfast, full dose of everything at dinner time. I would also get the ultimate, don't play with your paper. Yeah, put the paper on the floor. Thank you. Okay. You also want the Ultimate Daily Classic. Go ahead and take 3 of those at breakfast, 3 dinner time, a bottle a month, Ultimate Daily Classic. And then I would also throw in the, what we call the ultimate cardio sticks. The ultimate cardio sticks. So you tear the top off, you put them in a bottle of water and drink it. I would go ahead and take 2 of those a day. There's 1 per 100 pounds of body weight, so 1 at breakfast, 1 at dinner time. And they're going to support blood flow through blocked arteries. They're going to support lowering blood pressure. I don't know if you have a blood pressure problem associated with this sometimes. But this is all nutritional deficiencies. It's easily dealt with. And you do have to stay away from the bad stuff, the fried foods, the processed meats, the oils, and gluten, right? Okay? And again, the reason why your doctors don't talk to you about nutrition is because they don't know much about it. It's probably good that they don't talk about it.
I have one more question.
No, you only get one.
Oh,
Apologize. You only get one.
seriously? Okay.
There's one. Yes.
Hi, yeah, hello. I just
Hi.
wanted to clarify, with autism, you said that is it something that's, there anything to do now, or, I have a 6-year-old who has autism.
I missed that last part.
I have a 6-year-old who has autism.
Okay, autism. Autism is not genetic. Autism is a nutritional deficiency of the brain. We're talking about autism, ADD, ADHD, depression, manic depression, bipolar disease. Bipolar disease when you're in civilian clothes, when you have PTSD, okay, post-traumatic stuff. This is when you're in a military uniform. It's really just bipolar. And then there's schizophrenia, and then there's psychoses, anxiety attack, panic attack, all caused by the same thing. It's 1 or more deficiencies of the brain. The brain requires all 90 essential nutrients. Now, kids can be born perfectly normal, and then if they're deficient in their formula or the mother's deficient in the breast milk, then the baby will gradually, over time, it could be days or weeks, get autism. Or the baby can be born with autism. There's nothing mechanically or physically wrong with the brain, so that it's something that's fixable. Sometimes babies have autism, but they also have the equivalent of, even if the mother didn't drink or take drugs, they might have the equivalent of what would be called fetal alcohol syndrome, where they do have some permanent retardation because there's a little piece missing in the brain because mom was missing something. And then you can get rid of the autism piece, and the kid will be significantly better, but not perfect. So, I mean, there's all these possibilities. Without talking to the kid and knowing more history, it'd be hard to tell which one.
She can't talk, so
But
she wouldn't be able
she
to
was born
answer.
normal and sort of developed this at age 4.
She developed it, she was diagnosed at age 2. Age 2, she was
At
diagnosed.
age 2, yeah. Well, she was okay until she was 2, and then she developed at age 2. It's reversible. Okay? So what I would do is a child like that, what does she weigh?
50,
50 pounds?
yeah.
Yeah. So what I would do is get her 1 healthy brain and heart pack. That's going to last her 2 months. That's meant for 100 pounds for a month. So she weighs 50 pounds. That's a 2-month supply. And you mix up a full dose of everything, like it says, and then give her a quarter of a dose at breakfast, quarter of a dose at dinner. So that's her half for the day, right? And that should last her, that whole package should last her 2 months then. But get her away from the bad stuff. Again, last time, no fried foods, no processed meats, no oils, no gluten. And in her case, no sugar. That means no fruit juice, no fruit. She can get everything she needs from fruit, from vegetables. No stir frying. And you got to keep them away from the bad stuff because that's where the problem lies. Okay?
Okay.
Very good.